everybody, and welcome back to the main line. My name is Marissa Gahn, and today we have a really cool episode for you. It's very educational, very informative, and much so more on the clinical side. Today we have a special guest. Her name is Rebecca Abrahams, and she is a registered nurse more on the cannabis side. So I'm excited to jump on in. Everybody, welcome Rebecca Abrahams.
Hi.
Here she is. Hey there. Thank you so
How
much
are you?
for us today. I'm doing great. How are you?
Good. Thank you for having me.
Of course, we're really excited just because you're more on like the clinical side and you're a whole cannabis nurse. Before we get into that, I actually want to know, how did you start in the industry and what was your inspiration behind Acute on Chronic?
Yeah. So I'll try to make this super quick, but about 15 years ago when I was in nursing school, one of my last clinical projects, you have to choose a policy you want to work on. Now I wanted to work on recreational and medicinal cannabis legalization. Okay. I got a lot of kind of eyeballs from administrators and professors. They didn't like it. I had a long career as a critical care nurse in an academic hospital, and talking about cannabis wasn't encouraged either, but patients would ask us, because they always trust nurses, you know, I have cancer, what do I do? I have ALS, what do I do? Can cannabis help? And so on the side, I would be like, do you have grandkids? You know, this is what you do, but you don't know what's in it. But I wish we had legalized cannabis in California. If you know anyone in California, or at the time Washington, you know, call them. So I was always, you know, really interested in this work. I have a husband who's a physician, and my best friends are physicians too. And throughout our careers, we all keep getting questions. And then I discovered the American Association of Cannabis Nurses. My hobby, along with being a nurse, was actually doing public policy for families, women, and children. And one of the things I worked on was essentially outdated term, but moms for marijuana in Illinois. We helped it pass in Illinois for 2020. And so I was interested in the policy side and always in cannabis, found a certification. I was like, I'm a critical care nurse. I love learning. I can get another certification. Sure. And my husband was like, what are you doing? What are you spending all this time why are you reading all these books on cannabis? And I told him, I was like, there's a certification. And his eyes widened. He's like, doctors need you. And I was like, what do you mean? And he's like, we don't want to talk about cannabis. Like, our hospitals tell us we can't. I'm scared of my license, but you have a state license, and like, nurses teach all the time. If you get a certification, people will refer you. And so he was right. So I got the certification, and then I just gave it a try. And it worked out. So, you know, currently a lot of physicians refer me. Some of the top doctors in the country, when patients ask about cannabis, they're like, oh, the hospital doesn't like us to talk about it, but we have a nurse that we trust that, you know, you should see. So here I am.
Nice. Okay, so you mentioned that you used to be a critical care nurse. How does that, what does that mean? Well, yeah, what does that mean?
So, critical care nursing. So if you're in the intensive care unit, you would see me as your nurse. So it's one of the hardest areas of nursing. We have the sickest patients in the hospital. You heard a lot about us with COVID. We're the nurses that know how to do ventilators, and we know how to use life support. So I took actually a lot of my knowledge from critical care nursing. We know a lot about pathophysiology. I was board certified in critical care nursing, so I learned a lot about how our body works, and even things on the cellular level, because it's things like your best nurses should and do know. So yeah, we take care of the hardest people in the hospital, and doctors trust us a lot. So when folks are on a lot of drips, essentially what they do is the doctor comes in and says, put them on this drip, that drip, that drip. And then they leave. And then it's our job to consistently assess the patient and titrate. That means move a medicine up or down based on how you're doing. So we're kind of the ones in charge in the ICU, and we call the doctor, as needed, but they really, really trust us with our assessment, our education skills. So I took that over essentially to the outpatient world to do that with cannabis. And I compare a lot of my work to critical care nursing, because in the ICU, I did a lot of drip titration. And of course, you would have doctor around approving what medications a patient was going on, but the nurse kind of drives the bus. And I feel that's the same in cannabis. A physician will say, like, talk to this cannabis nurse, use cannabis. And then I'm the one who's like, okay, so let's do an assessment. Let's educate you. Here's, what I think's going to work for you. You should do a topical, have you thought about, vaporization, that kind of thing.
Wow. So, that just brought up a whole new thought process here. So you said a nurse is like driving the bus. So then let's transition into let's slowly transition, if we can dive in there.
Oh no. Sorry. All of a sudden I did this on my patio.
It's okay. You can't hear it too bad.
Okay.
You can hear it a little bit, but it's not too much. Okay, so let's see. What would it okay. So nurse being driving the bus. So what are cannabinoids? Can you define cannabinoids versus terpenes?
Yeah. So imagine the cannabis plant, and within the cannabis plant, there's 140 different cannabinoids. Cannabinoids are CBD, THC, but even more so CBDA and THCA. Those are the precursors to what you know is THC and CBD, but there's 138 more. So that includes CBG, that includes THCV. I'm trying to think of all of them. CBC, CBN. Terpenes are the essential oils of cannabis, and terpenes exist in all plant life. So the orangey, citrusy smell that makes oranges smell like oranges exist within cannabis. So the smell that comes from lavender, that in studies has been proven to be therapeutic, that is also in cannabis. That's linalool. I never say that right. But it's the essential oil of the cannabis flower.
Okay, so then what would you say would be that driving the bus cannabinoid?
Driving the bus cannabinoid, so it depends. THC is where most of the side effects from cannabis come from, but CBD does a lot too. So if you imagine, and I guess this leads us to something else. How the heck does cannabis work? It works on something called the endocannabinoid system. You might be thinking, what the heck is that? The endocannabinoid system is a neurologic system that's special because it talks to all of our organs. It's like the endorphin system, another system that you've heard a lot about. Opioids kind of work on this system. And the endocannabinoid system has receptors, and depending on what you're consuming, the cannabinoids compete for that receptor. So if you're using THC and CBD together, THC will try to bind with the receptor, but CBD will sneak in and be like, nah, you're not binding with this receptor. And they will both have a therapeutic effect.
Oh, so then what's the entourage effect?
That's the entourage effect. Yeah. So that competing for the receptor and then increasing the therapeutic effect, that's the entourage effect.
Okay, so basically, this is what I've heard. This is a myth I've heard, is that if you ever get too stoned and you're trying to come down, smoking or ingesting or consuming CBD will kind of create this entourage effect and kind of lower your high. Is this true?
This is true.
It's true.
So, yeah. Usually, if you utilize the CBD prior to using a THC product, it actually will help decrease some of that psychoactive effect, so you won't feel as high. But yes, once you're in the thick of it, if you're like, I've gone too far, my heart is racing, I feel anxious. Yes, taking CBD can decrease that high. Another thing you could do is just hydrate really well. Cannabis is something called a vasodilator. Vasodilation. Okay, so imagine your blood cell. It looks like this. So it's just a hole. When it vasoconstricts, it closes up. So that's like when you have hypertension sometimes, if you're in shock, if you lost a lot of blood, if you get a really bad infection, your blood vessels go like this. Constricting causes things like high blood pressure. It's not great to be constricted.
Right.
But when you use cannabis, so again, imagine a normal blood vessel, it opens it wide up. So that dehydrates you. So drinking water sometimes can kind of minimize some of the effect. Other things that could help is lemon rind and peppercorn.
Oh.
If you chomp on that, decreases some of that uncomfortable side effect from THC. It neutralizes terpenes is one of the theories as to why it works.
Wow. You know what? That makes sense because too much of something is never good.
Yes. There's actually an interesting, a couple of studies that talk about is less cannabis more. I do a lot of talks around the country about actually sexual wellness and sexual health in cannabis, which is super fun to talk about. I'm really passionate about women's health, especially menopause and sexual health, because nobody really talks about that. Like there's a lot of buzz and science around men's health. Like, we have Viagra, we have like 9,000 erectile dysfunction medications, but nobody talks about what's going on with the women. So I was like, I wonder if cannabis can help. It can. And in a lot of the studies, microdosing or minimalized dosing actually helps significantly with women's, sex drive as well as satisfactory sexual experience. Yeah.
Is that because these blood vessels are opening and the same thing goes for wine?
Yep. So the blood vessels open up. You have more blood flow to reproductive organs. And actually, it helps men as well. When I give these talks, I give like one slide to the men folks. I'm like, okay, dudes, here's your slide. It does open up. It vasodilates, which is the same effect that Viagra does to treat erectile dysfunction. And actually, cannabis has been used since the mid 700s in countries like Uganda for erectile dysfunction.
Wow.
Yeah.
So what was like the first thing that you discovered that was like, yo, cannabis works? What was that moment?
Ooh, oh my gosh, there's been so many. So in the last 18 months, I've had a lot of like really, really cool things, or even sometimes I'm like, wowzers. I have a couple clients where they're on, there's a couple medications where, it may be dangerous to use THC with, and they're really rare medications. There's a couple for narcolepsy, but there's also some for, synthetic opioids could be dangerous as well. Some medications for migraines if you're hospitalized. So I had one particular patient on one of those medications, and she only could use CBD. And I talked to her doctor, and her doctor was really hopeful. So was she. And I was like, look, I'm going to be honest with you. This might work, but it also might not, because I wish I could use some THC, and you're not going to allow it. So let's work with some CBD. And this patient's doing good on only CBD. And I was like, wow, that's great news. And even quite frankly, like I'm even surprised. Like I thought you'd get like minimal coverage, but it really worked. Another cool thing is I've had a couple clients come to me for pain control. Cannabis is used a lot for pain. Yeah. And I caught a call from their primary care doctor, and they're like, hey, all of your patients that we share, they've all gone down on their blood pressure medicine. Like their blood pressure looks good. Is this? And I was like, well, there's a vasodilator. It is in some studies that there's cardioprotectiveness and that it decreases blood pressure, but it can't be confirmed. And they're like, interesting. And so seeing people's other medical problems start to correct themselves is really fascinating. And of course, we can't, correlation doesn't equal causation. But I can't wait for it studied, because I would bet $100 right now that we will see that cannabis is going to be a really useful tool for controlling blood pressure.
100%. Ooh, I have a question because I get this a lot. As a bud tender, I'm one-on-one with these patients.
Yeah.
So I get this a lot, and I've always just like, just tousled it in my head, like, what's going on? Okay, so I know that like the endocannabinoid system is one of the first systems to kind of develop as we are in a fetus state. So my question is, what would go, I guess, I don't even know how to phrase this question, but what I'm noticing is that people really don't have like a great endocannabinoid like receptors. So they smoke the tiniest little bit and they'll like, throw up, but like eating it is different. Or the THC is making them sick, but the CBD is okay. So I'm like, what is up with their, and like it's got to be their receptors are off. But like what?
So what's interesting is the cannabis we smoke, vaporize, smoke, or even the sublingual oil. So what sublingual is, it's the oil you put under the tongue. That is called THC delta 9. When we eat cannabis, so edible cannabis is actually THC delta 11. So sometimes what we're seeing is people's response to one molecular structure versus another. For example, there are some people who do not metabolize edible cannabis. Think of it like being lactose intolerant. Some people likely lack that enzyme to break that down.
That's what I figured. I'm like, it all affects people different. People have allergies to everything. And I'm pretty sure this is just an allergic reaction.
Maybe. So sometimes look into, what is the carrier oil within the cannabis. I find that a lot of people are really, really sensitive to things like MCT oil as well.
That is so true.
Yeah.
Coconut, that's considered like a nut, right?
Yes. So whenever I do my assessment, I ask like, are you, tell me about your allergies. Do you have a nut allergy? I ask if they there's something in sometimes I sneak into medical conferences, and the benefit of being married to a doctor is I read his journal. Is there are people who hypermetabolize medications. And there is a synthetic opioid, tramadol. And I found a correlation. And again, more studies needed. But folks who seem to hypermetabolize things like tramadol also seem to hypermetabolize cannabis. So if they tell me, like, I used tramadol once after surgery and I felt high as a kite, that clues me into like, oh, if you take edible cannabis, you're probably going to really, really feel the effects at like 2 milligrams.
Oh, wow.
Yeah. So the trickiest thing about cannabis is it's a fussy plant. And it's fussy because everyone's biochemistry is very different. And so it depends on the individual, but then it depends on what the individual is putting into their body, because cannabis interacts with a lot of different meds. It interacts with actually like 60% of the medicines and supplements that we take, because it's where it's metabolized at. But also it depends on the plant. Like we talked about, there's 140 cannabinoids, there's dozens of terpenes, and the percentages of those, and also route of administration. All of that matters to, like, if somebody has a bad time, you might think like, whoa, what's up with that? Like, you only did 2 milligrams. Yeah. This person over here who's your same height and weight and gender took 10 milligrams and they were fine. Yeah. Why? And it's all of those factors going into play.
Okay. Yes. I knew that there was something deeper in it. So what are some common myths that you see in the cannabis world that you are really trying to, fight against?
Oh, so many. The first one is the killing of brain cells. This one drives me bonkers. The research says, and of course we're going to have more research, it's all going to come. And so far the kind of preliminary research actually says, no, it doesn't kill any brain cells. It actually is likely neuroprotective, and it actually helps with quite a bit of neurological disorders. I have migraines, so I use cannabis for migraines. And then, like all millennials, I have generalized anxiety disorder. I mean, who doesn't at our age, honestly? 2 recessions, a global pandemic, 9/11. Like, I don't know how if you were born before 2001, how you don't have anxiety. And I went to my neurologist, and he's like, "What are you doing now?" And I was like, "Oh, I'm a cannabis nurse." And he's like, "Give me your cards." And we were talking. He's like, "Yeah, I've seen some of your clients. I've had other people use cannabis, and my patients who were really wobbly while walking are doing much better. And my migraine patients don't have to use opioids, and it's giving people a lot of relief." And this is from, an academic neurologist who is really impressive, globally has done research saying like, wow, I've seen a lot of really impressive things coming from cannabis. So that's the first myth, is this like, it kills brain cells, it makes you dumber. That's not true. Cannabis has inspired so many creative people. It helps people work. I mean, like, granted, there are some jobs you should not do while using cannabis. Like, should I ever go back to the bedside? Don't use cannabis before your ICU nurse shift. Don't use it the night before either, probably. Truck driver, nope, not for day of consumption, exactly. But if you're in a creative field, advertising, marketing, writing, if you're an actor, musician, cannabis can be an absolutely useful tool. I know a lot of academics who actually use it to write and study.
Wow, this is true. This is true. So what are some type of products that you find are very beneficial for headaches and migraines?
Vaporizing cannabis is typically one of the best ways to kind of stop pain from migraines. So in the world of migraines, doctors look at two things, keeping away migraines, and then it's called an abortive agent. So what's going to stop your migraine? So I've read a couple studies where CBD use over time can decrease the incidence of migraines, and even some daily cannabis use, and then things to stop migraine in its tracks. So what I use, like if I get a migraine, THCA, that's the unpsychoactive THC. So you could use THCA and you do not feel high. So I take about 10 milligrams of THCA if I start feeling it coming on. And then if it's strong right before bed, I vaporize like a lemony sativa. Actually helps the most. The limonene terpene seems to help a lot. I've read, I always say this wrong, myrcene, there it is. The terpenes, they're the trickiest to say. They're like very organic chemistry. Seems to help. So that's one of my favorite things to use. Also, a daily CBD regimen never hurts anyone. And I always talk about, people always expect like, I'm going to take CBD and then everything's going to be better in 8 hours. No, CBD is much more boring than that. So CBD you have to use consistently and over 7 to 30 days.
Yes.
Will not feel an effect from it probably ever, but people notice its effect when you stop using it. And I tell my clients, I'm like, be patient. Like if you want to start using CBD, like don't get frustrated after 14 days. It's called lipophilic, so it absorbs in our fat cells, and that takes a minute. The good news is if you have to stop CBD for a couple days, if you travel out of the country and you come back, your CBD is going to start working again faster. And typically people notice when it like goes away. So daily CBD is also key.
Wow, that's a great point. You know what? That's a great point. That leads me into two different questions. First question.
Good.
Okay, so first question, you mentioned that you take THCA. Where do you find that? Is that like, where do you find that?
It's really actually hard to find. So if growers out there and, folks in the cannabis industry, please make and stock THCA. It's such a useful cannabinoid. I find it in a tincture. So I'm in Illinois. There's one tincture that exists out here. It's also in a patch, but some people feel the effects from a patch systemically, some don't. It's really hit or miss. So this THCA tincture has been magical. Yeah.
Wow. And you said THCA is non-psychoactive. It's all about
psychoactive. The other way to get THCA, although bear with me, if you take the cannabis, imagine the flower, and you eat it.
Yes.
THCA.
That's true, because you're not heating it up. It's not at that combustion point. So you haven't activated it.
Exactly. Yeah.
What about in a tea? Like if you heat up the tea in a hot boiled water, is that considered combustion?
No, because it has to be at a high enough temperature to decarboxylate the cannabis.
Okay.
I mean, like, could it happen? Yeah, but probably no.
Okay, because not too hot. Okay.
Yeah, it depends on how hot you get your water. I don't necessarily think anybody's boiling their water at like 270 degrees. But never say never.
True. Okay. And so my second question, you had mentioned that it cannabis itself is fat absorbing. So what this example comes from my friend. He actually went on a long tolerance break, but then for some reason, just like in a random day, he had just got this burst where he was like, am I high? I feel like I'm high. So he had just started a whole new like diet lifestyle regimen, a whole new workout regimen. He just started, he slowed down on smoking weed. He slowed down on alcohol, just a whole reset. And so he had said that it had just like burst and it had lasted for like a little hour. Is that a thing?
Yeah, it's a thing. Related to that process is a runner's high. So you ever hear people talking about a runner's high? That's actually our endocannabinoid system.
Oh,
It feels the same because you're releasing anandamide and 2-AG. So we make our own cannabinoids, which is really cool. We make about 3 to 4, but the big ones are 2-AG and anandamide. So yes, that is absolutely possible. What happens sometimes, and this is actually why, so if you have to take a drug test and you just found out about it, do not exercise because you're actually going to metabolize the THC and it's going to come out. And that's probably what happened to your friend. He probably like exercised, his adipose tissues were probably, doing what they do. They were shrinking down and they were, there's like a whole cellular process that happens that I'm going to bore everyone with. So I'll skip right over it. But while you're doing that, yes, the THC does come out. So it is possible to feel like, whoa, I feel like a lift. Yeah.
Wow, that's so crazy. I can't wait to tell him that.
Yeah. No, he's not crazy. That's okay. Very, very real.
Yeah, because we were just talking, we're like, that's weird. Does that happen? And
yes, it does. Yeah.
Oh my God, cool. Back to THCA. So when you notice the onset of like your migraines and your headaches coming on, what's your recommended dosage when you're kind of seeing and noticing that?
Yeah. So dosage with everyone is super different. So remember, what works for me is probably not going to work for
everybody.
50%, 75% of people. A good dose of THCA, I would say you could go a lot higher with THCA because it's not psychoactive. So I would say 10 milligrams is probably the bottom of the barrel, but most people can very comfortably go up to 100 milligrams, no problem.
Okay, true, because it's not getting you
not psychoactive. If you're in a state and if your dispensary sells THCA in a tincture or in an edible, the only thing I would just advise on is sometimes extraction methods when they pull out, when they're getting the THCA, sometimes it's kind of bundled in with THC, depending on who's growing it, who's making it. So just check the lab results on the back just to be sure that there's 0 THC. Sometimes, most of the time, actually, there's various amounts of THC, at least in the tincture I take. So like my particular tincture is 1,000 milligrams of THCA, but along with it is 27 milligrams. So just be sure before you take a whole tincture that you're not going to take like 10 extra milligrams of THC in it as well.
And so now you kind of touched on, I guess, different products that kind of help anxiety and depression. And that would be, I guess, limonene. But is there any other products that you've noticed benefiting anxiety and depression?
Yeah. So what's really fascinating, so my entire job and the entire basis of my work is reading through really boring research papers consistently and applying that to people and then explaining that to their doctors and collaborating all together as a team. In the research papers, CBD, so we sell CBD in like 100 milligram vials. A lot of the research regarding PTSD, anxiety, the beginning dose for CBD is actually over 100 sometimes. So the industry hasn't quite matched up with the research. I don't know the reason for that yet. But again, if you're making CBD, try to make bigger vials because that being said, so the recommended dose of CBD is sky high in the research, but we sell 100 milligram vials. How do you rectify that? CBDA is the answer. So CBD helps our cells metabolize CBD. Think of CBDA like a train, and the CBD hops on and it's able to go more into our cells. And what I've noticed is people seem to get a better effect of their CBD when using CBDA. So people look at me like I'm crazy. Even a grower was like, why are you recommending CBDA with CBD? Seems like two different things. But that's the reason, is because I'm trying to get folks to a therapeutic dose, whatever that might be for them. And what's cool about CBD and CBDA, neither of them are psychoactive. And the World Health Organization in 2011 said that CBD is actually one of the safest supplements we could take. No withdrawal symptoms. So you could take 1,000 milligrams of CBD every day, and then one day just decide like, this isn't for me. And nothing happens to you. Nothing. If you restarted it, that would be fine too. Nothing happens to you. You don't have to work back up to it. There's no lethal dose, which is awesome. Nearly everything in the world has a lethal dose, not CBD. And there's very little side effects from CBD. The worst side effects from cannabis in general and CBD is kind of how I touched on, is the drug-drug interactions. That's the most dangerous part of cannabis, is the other stuff that it's interacting with. And that's kind of why I exist.
What would you say, that kind of puts a little spotlight on things? What would you say would be like your top, like, other drugs where it's like, if you're taking this, this, and this, please be advised. Please heed my warning.
Yeah. The drugs at the top of my head that are most common are something called Coumadin, also known as warfarin. It's a blood thinner. If you are at risk for a heart arrhythmia, stroke, if you have a blood clotting disorder, you may end up on this medication. It interacts with CBD a lot, and it increases the amount of Coumadin in your body, which means that your bleeding time will be longer. If that is not followed up by a doctor, and if you're not checking your labs levels consistently, you could have a really high level, and if you fall and hit your head, you could have a really, really, really bad bleed that will require surgery. You could have a lot of blood loss. So that's one of the most important ones. The second one is Plavix. What's Plavix? Plavix is an antiplatelet. I'm going to say this wrong. Apology. I can't believe I've been a nurse this long and I still can never say the official term. Clopidogrel. I didn't get that right. But Plavix. So if you've had a heart attack within the year, you're likely on Plavix, and you stay on that maybe for life, but definitely a year after a heart attack. If you've had a heart attack and you go to a place called Cath Lab and you get the thing inside your heart called a stent, opens your coronaries up, you will be on Plavix. What cannabis and Plavix does together, cannabis likely decreases Plavix in our system. If you decrease the amount of Plavix, that means you're at risk for your stent closing. So if you have had a heart attack within the year and you have a stent and you're on Plavix, you should not be using cannabis, just because we need more information. We don't know. And there was a paper published in a conference about last year, which is interesting because I was working with somebody and I saw the interaction and I was like, whoa. And I called every doctor I knew and I was like, did you guys know this? And they were like, no, how bad is this? Should we be asking everyone if they use cannabis? And I was like, yes, always. But we discovered it. And then another physician I know sent me the paper and he was like, did you see that people using cannabis are having second heart attacks in a year? And I told the doctor, I was like, I bet that's because of the reaction with Plavix that I just found. I'm sure other folks have stumbled upon it as well, but yeah, Plavix. Other medications, it could kind of do things with cholesterol medications like lipitor. It could increase, the amount that's in your body. It increases sedation of things like Xanax, trazodone. And then the other big things to watch out that cannabis is probably a no at, unless you, really talk to your doctor closely. Things like Xywav is a medication for narcolepsy. And then there's about 3 very rare synthetic opioids that have a don't mess with it. I can't remember those. I haven't seen anybody on those literally in 10 years. So, but if you're on anything, you should definitely, please, even if your doctor is mean and scary about it, please, 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 please tell your doctor you're using cannabis. And if you're really, really frightened to tell them, at least say, hey, I'm using CBD. CBD is legal in all 50 states and treated nearly the same as cannabis. It doesn't quite have that stigma that, you know, we're all working very hard to destroy every day. But at least say like, hey, I'm using CBD. And then, of course, if you're scared to talk to your doctor, that's what cannabis nurses are for. You could call us and we'll have that conversation with your doctor. And, you know, we're kind of used to being, you know, bossed at, and we're used to having scary conversations with doctors. That's all we do.
So okay, a common thing that I noticed is, I guess, if you have blood issues, or which then I guess would make sense with what is it called where your vessels,
vasodilation.
there we go.
Yeah.
Okay, wow. So it's got a really direct link to your blood vessels. And then you had said lipitor, and that's lipids. So that goes with the fat.
Well,
lipids.
Lipitor, yeah, decreases cholesterol in the body overall. And there's a couple studies that kind of show that cannabis can help decrease cholesterol overall. Cannabis users have decreased BMI, which is really interesting. That's another myth. Cannabis users are all overweight. We gain weight. We eat too much food. We're sloppy. That's all nonsense too. Cannabis users actually have a lower BMI than your average person, even with increased caloric intake. So you can use cannabis and you can eat more. Like there's nothing. And
why is that? Why?
We don't know. So this particular study that I'm talking about studied 33,000 people. 33,000 people for a study is a huge number. And when they followed these people, I believe it was over a year or two, the cannabis users, you know, some of them did gain weight, but overall their BMIs were lower than your non-cannabis user. Part of that reason is like, is it more cardioprotective than we know about? But also there's a function of CBD where they think that it kind of changes the composition of our fat cells.
Wow.
Yeah.
Oh, wow. I actually I've noticed that in my own personal experience. Like when it picks up, the BMI goes down.
Yeah. And weight loss is technically easier on cannabis and CBD because people with pain can exercise more. It decreases inflammation. And one thing I want to say that's really interesting is I know sometimes when I'm like, cannabis can help with that. Cannabis can help with that too. It sounds like I'm lying. It sounds like I'm selling snake oil. People imagine me as like an infomercial. And it's not. And here's why it's not made up science. The endocannabinoid system that we talked about, the reason why it works on like 10 different things is because it's really closely tied to and affects something called our HPA axis. Just remember HPA axis, but it's technically called the hypothalamus pituitary adrenal axis.
Ooh.
What does that do? Everything. It does everything in our body. It controls a lot of our hormones, our neurotransmitters, like everything is tied to this system. It helps with bowel motility, inflammation, our circadian rhythm. So the endocannabinoid system being really closely tied with that system is kind of why we see a lot of really beneficial things. A thing that a lot of folks say in our industry, but I haven't seen translated to healthcare, is a lot of people say, what does the endocannabinoid system do? It maintains homeostasis. But when I say that to doctors and nurses, they're like, what? What does that? Because it doesn't mean anything to them. So I one of the first things I did is how do I translate what this means to people who speak in a totally different language? Because a lot of what I do is trying to take the cannabis world and make the healthcare world understand it, and figuring out that it works on the HPA axis, and kind of the endocannabinoid system wants to, you know, rebalance things that are going haywire. That makes sense to them. So
true. You wait, what was it? The axis, HPA axis?
It's called the hypothalamus pituitary adrenal axis.
Okay, and that, correct me if I'm wrong, that's in the brain.
It controls cortisol, inflammation, bowel motility. A lot of other medications kind of work on that axis as well. Cannabis, I believe, on this axis also increases serotonin in our brain, which is why we only you're more likely to feel more positive feelings when using cannabis instead of like negative ones. Kind of blocks out a lot of the like unpleasant feelings of life.
Wow. Yeah. Wow.
Yeah.
I gotta write that down. I have to do some more research on that.
No, it's okay.
Interested in in the brain, because this is
Yeah.
the motherboard to the rest of the body. Wow. What kind of, I guess you kind of touched on it a little bit before we open up the floor for more questions, but I kind of wanted to tap on it before we move on. But I guess cannabinoids that would help with gastrointestinal issues.
Yeah. So things that work really well for gastrointestinal problems are going to be one-to-one THC CBD combinations. There's been a bit of research on it, how it helps. Definitely THC is important for gastrointestinal problems. CBD alone doesn't do enough. Of course, though, if you have something like Crohn's disease, ulcerative colitis, irritable bowel syndrome, decreasing inflammation is really, really vital. A lot of these patients in the medical world already take corticosteroids. And one of the earlier research that came out about THC as well as CBD is it's a really powerful anti-inflammatory, possibly as strong as corticosteroids. Now, I'm not saying, never stop any medication in lieu of cannabis, talk to your doctor. But I have heard from physicians that folks that have used cannabis and THC ultimately sometimes require less steroid dosing than others. And less steroid dosing means less side effects. So that's great. Other things, THC, sometimes if you have essentially bowel issues or any kind of gastrointestinal issue, is eating becomes really problematic. THC increases appetite. If you use it strategically, it doesn't necessarily have to. Like I said, it could be great for weight loss, but it also is great for weight gain. So it helps people eat. And people who, have bowel trouble, sometimes they're not encouraged to eat because they want to get through their day without, having an irritable bowel. And the combination of being able to eat more and decreased inflammation kind of allows them more comfortability. Also, the THC and CBD combo helps with pain as well. I've also seen people with bowel discomfort be really, really helped and kind of have normalized bowel movements by using cannabis as well.
Wow. Okay. Good to know.
Yeah.
Okay, so let's open the floor for any questions. Anybody have any questions for our special guest today? Please let us know. I actually do want to touch on Acute on Chronic and your mission. What is Acute on Chronic? What's your mission there?
So my mission essentially is to kind of normalize cannabis and take away stigma and make the healthcare community and physicians, providers, and nurses and healthcare companies and these huge hospital corporations comfortable with cannabis. One of the things I like to talk about, feel free to have me back. I really like talking about the history of cannabis, because how did we get here? Yeah. Like, how did we get to a place, like a really dark place where cannabis is prohibited, where there's all these like really nasty things said about cannabis and the plant, people who utilize it. Like, how did that happen? And it essentially happened because two rich guys wanted to make a profit and hemp was in their way. Mm-hmm. The AMA in the beginning, when they testified in Congress, they kind of testified late because they didn't know what the heck these people were talking about. They kept hearing the term marijuana and they're like, we don't know what that is. That plant sounds really dangerous. And then they're like, wait, they're talking about cannabis. We better go testify. So the American Medical Association said, if you make this illegal, you're going to mess up really positive research. Like, we are just coming into like the kind of golden age of medicine, and research is going to show this to be really useful. please don't ban this. Banned anyway. So kind of lifting that stigma to open the door up for more research. I personally really, I swore off of any more education for myself. I was like, I'm going to open a business, and like, I do not want to spend any more money on education. And now that I've deep dived into cannabis, I'm like, well, I have to do some research. So I have to get a doctorate. So now I'm, on my way to getting my doctor of nursing practice while running a business. So more research, acceptance in the medical community at large globally, and to make people know that this is a pretty safe supplement to use.
Yeah.
And to just have it more accepted, because I really, not a month goes by where I'm getting screamed at by a doctor who's calling me a drug addict, that's calling, that's saying like really nasty, untrue things as I'm trying to educate, like, no, doctor, please listen. Like, I will give you free education. Like, I will buy you lunch. Like, I buy people lunch so they will listen to the science of cannabis. And then a further goal, I see myself more as a social enterprise than, a corporation. I'm a nurse before I'm a business owner. So I try never to turn down a client. And so I'd love to construct some way to be able to literally offer this service for free to people who need it. So if you are a large corporation or foundation, please feel free to collaborate with me and donate money, and I will happily see anyone you want. And to essentially grow cannabis nursing into a legitimate specialty. So I have a lot of really, really lofty goals that I hope to accomplish.
And just keep that eye on the goal, and you got it.
Yes.
All right, let's see. Our first question. I lost 40 pounds using cannabis. It suppresses my appetite at the right times. Okay, so that kind of touches on, similar thing. Have you noticed any particular like strain of cannabis that kind of onsets that suppression appetite, or terpene?
Yeah, the citrusy terpenes really help with appetite suppression. THCV. If you are in a state that carries THCV, California carries it. THCV actually works as an appetite suppressant, so that could help a lot. I would say the citrusy terpenes, probably inline more sativa strains. I'm trying lemon bean. Seems to be an appetite suppressant. It's not one of the first ones I recommend to folks who want to increase their appetite. So, yeah.
All right, more questions, y'all. Come on, give us the question.
Yeah.
Okay, let's see. Is this with Plavix and THC products? Is this with?
It's probably both with THC products and CBD products, and kind of to go in deeper. So one of the reasons why we're kind of desperate for more research is we don't know exactly like what amount of, what milligram amount of CBD or THC triggers a drug-drug interaction. What we do know is, so cannabis in Plavix is metabolized in cytochrome P450. What's that? It's an enzyme system within our liver that breaks down most of our medications. Plavix and cannabidiol, but as well as cannabis, so that's plant cannabis. We know that both of them are interacting there, and we know that when you use cannabis with Plavix, it's hogging that enzyme system, and so Plavix, there's just not enough. Like it may decrease the amount circulating in your blood, and so we don't know what that happens at. So just risk benefit. Cannabis is available to anybody who wants it in legal states, but I really wouldn't recommend it until you're at least a year past your cardiac event.
Good tip.
And still talk to your doctor.
All right, let's see. What is the fastest way to reset without taking a long tolerance break?
Ooh. CBD.
Yeah.
CBD. Yeah. You do build up a tolerance over time to THC, and how long it takes to get to that kind of where you're at a tolerance. Depends again on our own biochemistry. We don't know. Could be 6 months for some people, could be 2 years for other people. Consistent CBD, but otherwise there's really no way to reset it because it is metabolized in our fat cells. Another way is to potentially, decrease your fat cells. Exercise could work. More studies are needed on this as well. I'm sorry. I feel like a parrot. I'm like, more studies are needed. More studies are needed.
I don't know. All right. What strain is good for muscle stiffness?
Aha. Let me think. Blue Dream is a really good strain for muscle stiffness. Other strains that are good. I like Strawberry Kush a lot. For muscle pain. Other things for muscle pain is don't be afraid to do multiple routes of administration for things like muscle pain. Actually, don't be afraid to do multiple routes of administration for a lot of things. There was a study out of New Zealand that talked about for endometriosis pain, what actually helped was rubbing an oil on the abdomen. And now that's another thing that surprised me. In nursing, never, ever have I been like, yes, rub this oil on your belly. It will definitely decrease your abdominal pain. Like that's never worked. And oddly in the study, it does. So I started recommending, I was like, if you have endometriosis related pain, maybe you should try like a cannabis cream. Using a cream for muscle stiffness as well as a tincture or smoking or vaporizing or an edible can be really good. So don't be afraid to do those things. Also Star Killer, if you can get your hands on it. And then if you're a grower listening or a cannabis company, like you don't have to make new strains. The old strains are really good and sometimes they're getting harder to find.
Yes.
Like for migraines, OG Shark, one of the sharks is really good for migraines. And it's in research. Research very rarely mentions a strain. And in this particular case, yeah.
True. There is actually a strain called Shark Shock, and it's like 1-to-1 a THC and CBD.
Ooh, that could be good too. Yeah.
All right, next question. What is THC Delta 10? True.
Ooh, this is a hard question. Dang. I don't know a lot about Delta 10. I know a lot about Delta 8. And I know, talking about Delta 10 and Delta 8, if it's a synthetic cannabinoid, and I have to look this up. So email me and actually feel free to pass me along anyone's email or like any way I could answer this because I'm going to look it up and give a real answer. Okay. If it's a synthetic cannabinoid, I would actually stay away from synthetic cannabinoids. When cannabinoids are manufactured in a pharmaceutical lab or any kind of lab, it's not as safe. It binds to our receptors too well, and there's significantly more side effects. So this is why we see even things that have been FDA approved, like Marinol. Marinol, there are way more side effects. It doesn't work as well. And there's actually been a death related to it. And the really bad kind of synthetic cannabinoids like K2 and spice, you see a lot of deaths and really bad outcomes. And that's actually because it's super duper binding with our endocannabinoid system. So I would say, like in general, plant-based cannabinoids are your best bet. They're affordable. They're really, really safe. Synthetic cannabinoids don't know a lot about, and they could probably do some damage. So, but I'm going to look that up. Feel free to like pass me an email address. So I'll get on that. But in healthcare, I don't know. I know what I don't know. And I don't like making it up. So I'll look it up for you.
We'll put your information in.
Yes, exactly. And please email me.
All right, let's see. Another question. What's better, smoking or vaping? This is a good question.
Yeah. So in a study, another rumor that I'd like to dispel, cannabis can cause lung cancer. Probably not. So disclaimer, anytime we put anything in our lungs that isn't room air or oxygen, like there's a risk. So, and that includes like walking outside in a city, you're breathing in pollution, emissions. We don't really know what's going on. In a study, they kind of studied cannabis, smoking cannabis versus cigarettes, and the cannabis users after 7 years of daily cannabis use were not at an increased risk for lung cancer. They also had increased something called vital capacity, which is kind of how deep we're breathing.
Oh, wow.
That really surprised the researchers, and they kind of said like, cannabis users take more deep breaths, was their conclusion. So smoking cannabis, risks for later in life. If you were a daily user and you smoked for 10, 20, 30 years daily, you are at risk for bronchitis and COPD. But less so than cigarettes. Vaping, we all heard about e-cigarette vaping lung disease, EVALI, in 2019, that has seemed to since disappear. It hasn't disappeared. What happened is more states legalized cannabis, and we now have kind of states monitoring what's going inside vaping pens. So vaping can be safe, but watch your extraction methods. You do not want... so many people are going to be mad at me about this. Just double check who's extracting with butane. You have to be sure that they're doing it right. If you're extracting with butane and they're not extracting the butane back out, it could be benzene. When you inhale benzene, that's bad. It's a carcinogen. If they're using CO2 extraction methods, much safer. Also, just be sure that there's no added terpenes. So natural terpenes are fine. Added terpenes could be really dangerous. Added terpenes, we don't know the long-term health effects of that. There's a risk of something called popcorn lung. And what happens is popcorn lung is long ago in a butter popcorn factory is people were inhaling the smells of popcorn, and it was causing really bad lung disease. So if you use a vape pen that is extracted, CO2 extraction, no added oils, no added flavors, it's probably pretty safe. The safest thing to do to consume your cannabis in a smokable way is to take cannabis flower, buy a vaporizer, pack your flower cannabis, and smoke it that way.
Yeah, true. Wow. Okay. So I guess that kind of wraps up the floor for questions. That's a really good point, actually, because I do enjoy vaping, and I've always gone with CO2, always.
Good.
But now there's something new on the market where they've added terpenes and added botanicals. What would you say are like? Should we go with the added botanicals, or just stay away from?
I know. I would stay away for now, because we don't know, because of that popcorn lung issue of added things, just to be on the safer side. And it kills me to say that, because actually I personally really like the added terpenes and I like the added botanicals. But one day I was thinking about it, I'm like, this is probably really dangerous for me. And nurses were the worst. We're the worst. We're the worst patients, because I'm like, this is bad for my health. But I'm really enjoying it. You can, but at your own risk. We don't know yet. There have been really surprising studies in cannabis where things we thought were totally wrong. So in the things we don't know yet, err on the side of caution, but Okay. But I will say, I have had people who are definitely terminal with really bad diseases. And when the goal is we're just trying to get folks to enjoy the last of their life and eat and have a nice time, I'm like, you know what? Give vaping a try. If it has a flavor, I just, go out, see your kids, eat barbecue, whatever we got to do to get you there. It's okay. So.
Eat barbecue. Wow, thank you so much, Rebecca. So what's next for Acute on Chronics? What's next for you?
So I hope to keep doing this, keep educating. I love speaking. I love educating. I'm growing. I'm adding more nurses in multiple states. So I'm about to grow into the New York area, which is going to be super awesome. Las Vegas area, California, hopefully have nurses on the ground there, in Colorado as well. But then we are available in all 50 states via, Zoom. So you can get in touch with us via our website, which is www.acuteonchronic. Yes. Our Twitter, Acute on Chronic RN420. And then our Twitter is just Acute on Chronic. Facebook is Acute on Chronic. And then I have a TikTok.
Nice.
I as long as they don't shut me down, I want to do educational videos on cannabis. What the heck is my TikTok? I think it's Acute RN420. I think is my TikTok.
Nice.
Or you could just look up Rebecca Abraham. So I'll post it on my other social media. But yeah, check us out. Find us if you have a cannabis question. Call us. And don't be afraid to hire us for your mom or your dad or your grandma. Lots of people force me upon their elderly relatives. And part of my work is to destigmatize cannabis. And yeah, so I hope to grow and do this work hopefully one day for free. And yeah, any questions, you want to join me, feel free. Yeah. And then I should give a telephone number too. So my email as well is Rebecca at acuteonchronic.com. And then my telephone number is 312-767-7339.
Okay, yes. If you get into direct contact with the R.
Yes.
Well, thank you so much. You're a whole cannabis nurse. This has been an honor for me. This opens a whole new world, not just for me, but I know our viewers out here have gotten a lot of insight, and I know they're all rolling with more questions. So please, everybody on our live, reach out to Miss Rebecca, ask her all your questions, visit her website in case you are interested in her services. That is it for us on the main line. Thank you so much, Rebecca. Is there anything else that you wanted to add for everybody?
Oh, just, I can't wait to, hit me up if you, have any questions or you want to introduce me to your local dispensary. I'm happy. Literally, I will partner, as long as your dispensary is responsible and if you're a grower, if you're a cannabis company and you're making a good product, you're responsible, I would love to partner with you. I'm always looking for reputable brands and things to recommend to my patients and clients and physicians so they know, what should they be doing. I'm here. So
yes. Well, thank you so much, Rebecca. We really honor you. Thank you.
Thanks for having me. I appreciate it.
Until next week, everybody, we will see you on the main line.